Please welcome to the stage Chief Commercial Officer of Quest Analytics, Brent Sanders.
Good morning, everyone. Hey, welcome to day 3 of AHIP 25. This has been an amazing week. There's been so much excitement this week, some great communication. We're in the home stretch, but there's a couple more things we need to talk about. So I'm really looking forward to sharing some ideas with you today around provider data. However, first, I need to remind us that this is the Innovation Spotlight session. And hey, all innovation in healthcare is not artificially intelligent, though we think it is. So there are things in healthcare that are innovative where we need the entire community to come together to advance healthcare. And I'm going to be talking to you about one of those things today. I am Brent Sanders with Quest Analytics. No, we are not that lab company. So who are we? So Quest Analytics, we are a provider data management company. We are a network adequacy company. We're a provider accuracy business. We work with 95% of America's health plans. So we have a unique position with the data that we have. We also work with CMS, SOCIO, all the state regulators, large health systems. So we're in a kind of a unique position, a position of responsibility where we have relationships with almost every health plan, with large health systems providers, and with all the regulators. So let's talk for a minute about this week. We've heard several themes. We've heard about sustainability. We've heard about affordability of healthcare. We also have talked a lot about access to care. And that's one thing we're going to be talking about here in a few minutes. So healthcare, we're data rich. We don't need more data. We have data coming at us from all kind of places, all kind of sources. But sometimes we're information poor. So we're going to talk today about how to use provider data to become information richer. I've been in healthcare a long time, 35 plus years or so. The early part of that, I want to talk to you about I want to take you backwards for a minute. I want to talk to you about a journey. Early in my career, we were all working together to figure out patient data. How do we get patient data together to provide better health care? I don't know if you remember this, right? Patient data lived in manila folders on a fax machine. Do we remember those? We still have some of those. We have to get beyond that one day. So patient data lived on fax machines, printers, a provider's desk, several floors in a hospital system. So we all came together as a community. It took the entire community. It took regulation. It took government, MIPA, interoperability. It took every health plan to come together. It took providers. It took a myriad of healthcare technology vendors to come together to get us to a place where we could consume patient data so providers could make better decisions, provide better health care. Really important. It's been a journey. It took decades to get there, to get to where we are. And we have a long way to go. But it did take a long time. But today, I can go to my phone, I can go to mychart.com, I can look at my history, I can look at all my medications, I can actually see the doctors I've been to. I go to my provider, he actually knows my history now. So we can make more informed, more efficient, better healthcare decisions. Now, so that's a great journey and great progress. But I want to say that we've got a similar journey that we're in the middle of now with provider data. As we think about that, our provider networks are foundational to the things we talked about: sustainability, affordability, and better health care and better access to care. So provider networks have become very strategic. how to differentiate the health plan, how to provide access to care, how to make sure that our members are serviced in the way we want to care for them, how to become more efficient. So as we think about that, I want to share with you a challenge that we have in the industry, where that we're all coming together again to solve this. So let me give you an example. Let's say you're moving into Atlanta as a new market or a new line of business, Medicare Advantage, Medicaid, commercial, QHP. You're moving into a city like Atlanta. Today, there are almost 3,000 medical providers in Atlanta, but we look at them at an NPI level. The industry has kind of coalesced around every provider has an NPI number. That's how we look at them. That's how we manage our businesses and our networks. That's no longer sufficient. We've heard from our health plan clients for the last several years, we have to get beyond NPI. We can't manage our networks that way anymore. It's not efficient, it's not gonna work. So what if, instead of 3,000 NPIs in Atlanta, as we go in to build a network, to modernize a network, to increase the performance of a network, to better serve our members, what if we could look at that in the actual, there's only 400 contracting entities in Atlanta. So if we can look at it from that perspective, it just changes the way we view our business. So we want to look at, of those 400 contracting entities, there may be 200 that we want to work with to be compliant, to meet all government and state regulations, and to service our population. So 200 is a much better number than 3,000. What does that mean? So historically, we have viewed practitioners from a data standpoint as an NPI number, an NPI 1. We have to move beyond that. We have to think about the institutional affiliation as one. Let me give you an example of why that's important. So surgeon in Atlanta, we need to contract with, put into our network to be compliant, serve our membership. That surgeon is in a practice of 8 providers. There's a contracting entity for those 8 providers beyond the NPI level. However, they're also affiliated with Emory Healthcare System. So if you go contract with Emory Healthcare System, you get that provider, his practice, and 1,860 other providers. So you got, in order to make that decision, do I just contract with the practice or Emory, you need to know the contracting entity and then the affiliation, the hierarchy, the laddering up of that practice. This data exists, but heretofore, it has not existed in the context of how we build networks. We also need to know the professional affiliation of that practice. Then we can learn who the contracting entities are, and we can make more informed decisions, more efficient decisions, about how we build, how we modernize our provider networks. As we think about that, this is a way that we can become not only data rich, but information richer. We have worked with many of you, many of the health plans all over the country the last several years, to really create this data source that we at Quest now call affiliation insights. This has been an ask from the industry. We feel that we have an obligation, since we have this rich data set and have all this information together from almost every health plan in the country, that it's our responsibility to help advance this. So with that, I want to say thank you for listening. Thank you for all your collaboration around this project. Thank you for all your help and your leadership. And I just really thank you for being here today. And going forward, I want to wish each of you safe travels till we see you again. I look forward to the collaboration. Thank you all.